You may have heard that communication is important, whether it's with your children, your friends, or your family. There's one conversation, though, that could be the most important one you'll ever have. And that's the conversation where you share your end-of-life care wishes with the people that are closest to you. This talk also might be the hardest one you'll ever have. Our goal is to introduce you to advanced care planning, guide you through this important discussion, and encourage you to share these decisions with your loved ones. What is advanced care planning? Advanced care planning involves making decisions about the type of medical care and treatment you would like to receive if you were unable to speak for yourself or if you had a serious advanced illness. When you have a serious advanced illness, it may be difficult to discuss the types of medical treatments you want or don't want as your illness progresses. Advanced care planning can help you design a treatment strategy as you move through life. Many times the goals of care you may have when you're younger may not be the same as those you make when you're older and have a care plan. In this video, we'll help you organize your thoughts about your end-of-life care wishes so that you can make your decisions and share them with your loved ones. Planning ahead can give you and your family peace of mind, prevent questions, confusion, and disagreements between family members, and provide important information to your healthcare team. Let's get started by learning more about advanced care planning.
I'm Dr. Susan Nelson, and as you prepare to share your wishes for end-of-life care with your loved ones, it may be helpful to know a few facts about advanced care planning. For example, 60% of people say that making sure their family is not burdened by tough decisions is extremely important, yet 56% have not talked with anyone about their end-of-life wishes. 70% of people say they would prefer to die at home, but 70% die in a hospital, nursing home, or long-term care facility. 80% of people say that if seriously ill, they would want to talk to their doctor about end-of-life care. 93%, though, report never having had a conversation about what will happen next with their doctor. 82% of people say it's important to put their wishes in writing, but only 23% have actually done it.
At this point, you don't have to talk yet about what you want. You just need to think about it. One idea may be writing a practice letter to yourself or having a practice conversation with a loved one or friend. These exercises can help you describe your feelings and may reveal any potential disagreements you and your loved ones may have about the kind of care you want as your illness progresses. It's okay to disagree, but it's important to talk about it now rather than during an emergency situation. Families very often want to have everything done to keep their loved ones alive, but what they don't realize is that doctors are going to do everything that will work. In many cases, there are lots of treatments that can cause more burden than benefit. How do you decide on the types of care you want and don't want at the end of life?
Many times, doctors use words that are unfamiliar to us. Let's talk about some of the treatments that would be available to you and what they mean. Cardiopulmonary resuscitation, or CPR, is an emergency effort to restore breathing and heartbeat once they've stopped. It may or may not be successful. CPR involves chest compressions designed to provide blood circulation until emergency responders arrive. The emergency care team may also use a defibrillator, which administers an electric shock to the heart to restore a heartbeat. Mechanical ventilation involves pumping air into and out of the lungs through a tube. CPR may be beneficial to healthy people who die suddenly, but may not be helpful for those who are frail or who have serious advanced illnesses. If successful in restoring circulation, CPR may present risks such as a lack of oxygen to the brain, resulting in decreased physical or mental ability. Do Not Resuscitate, or DNR, refers to a medical order that tells healthcare professionals not to attempt CPR if a patient's breathing and heart stops. It does not mean do not treat. It always means that comfort will be provided and basic needs will be met. Comfort-focused treatment is always provided. It is treatment focused on pain and symptom management with medication, or other things like positioning, cool air, or gentle massage. It is not meant to extend life, although some studies have shown that it may. Artificial nutrition, or tube feeding, is a way of providing food and fluids through a tube either in the nose or directly through the skin into the stomach. Tube feeding can help patients who cannot swallow now, but who are expected to get better. Patients who are nearing the end of their life need less food and fluids. During this time, bodies are unable to use food and fluids like a healthy person. Some patients may be more comfortable eating just what they want. In many cases, tube feeding causes more burden than benefit.
Now that you've learned about some of the treatments and you may have begun to think about your wishes, what else do you need to consider before having the conversation? Please consider the following statements and decide if in your case they are true or false. My loved ones know exactly what I want at the end of my life. I'm worried that I will not receive enough care at the end of my life. I'm worried that I will receive overly aggressive care at the end of my life. I just want to be made as comfortable as possible at the end of my life. Your answers will begin to form your wishes. Here are a few more things to consider that may help you identify your feelings. As a patient, I only want to know the basics about my condition. I only want to know enough to make informed decisions. I want to know everything about my condition. When it comes to treatment, I want my doctors to do what they think is best for me. I want to have some say in what treatments are given to me. I want to have a say in every decision related to my care. At the end of life, I want my wishes followed, even if it makes my loved ones uncomfortable. I want my loved ones to do what brings them peace, even if it goes against my wishes. I want to work with my loved ones to determine my wishes. Now that you have an idea of what you want and how the conversation should go, how do you put this into action?
After organizing your thoughts, it's time to discuss what documents are available to record your wishes. The Advance Directive, also known as a living will, is a legal document that provides instructions specifying what kind of treatment should be given to you when you're no longer able to make decisions or speak for yourself. Generally, a living will describes certain life-prolonging treatments and states which ones you do or do not want in the event you suffer from a sudden, irreversible, life-limiting illness for which you are not expected to recover. A living will only goes into effect if you've lost the ability to make decisions and have a life-limiting illness. It is usually completed in advance of any known illness. Because you complete it yourself, unless there are other known facts, it must be honored. An advance directive does not need to be notarized, but it must be witnessed by two people not related to you by blood or marriage in order to be valid. The second document to consider is the healthcare power of attorney. This legal document enables you to designate someone you trust to make or communicate healthcare decisions for you when you can no longer make those decisions or speak for yourself. To become valid, this document must also be witnessed by two people not related to you by blood or marriage. It is recommended that this document be notarized. Once you have selected a representative to speak for you when you cannot, it's important to let that individual know and to share your wishes with him or her. The Louisiana Physician Orders for Scope of Treatment, or LaPoste document, is more than an advance directive or a healthcare power of attorney. It's a physician order. To qualify for a LaPoste document, you must have a life-limiting and irreversible illness for which it would not be a surprise if you died within the next 6 months. The document outlines your plan of care. It can also be used to translate an advance directive or living will into a physician order. To become valid, the LaPoste document must be discussed and signed by you and/or your healthcare representative and your physician.
There are many things to think about, but you may also need to decide who you'd like to talk to about your end-of-life wishes. Who do you trust to speak for you if you're unable to speak for yourself? Once you decide who the right person is, you may want to think about where you would feel most comfortable having this talk. Ask yourself a few more questions. What is most important to you as you think about the last phase of your life? Do you want to be actively involved in decisions about your care? Where do you want or not want to receive care at the end of life? Home, nursing facility, or hospital? And finally, here are a few more suggestions to consider. It's important to be patient. You've had time to think about your wishes, but your loved ones may need a little time to think too. You don't have to lead the conversation. Open the discussion. Just let it happen. Don't be upset if your loved one's beliefs about end-of-life care don't mirror your own. Be willing to listen and ask them to listen to you, too. You and your loved ones can always change your mind as your circumstances change. Nothing is carved in stone. You don't have to discuss everything in a single conversation. This may be the beginning of several conversations. You are the expert on what you want at the end of your life. Don't be afraid to say so. We appreciate your attention to this program. There are many other resources available on the La Poste website at la-post.org. I encourage you to visit the site and use these materials. Remember, it always seems too early until it's too late. Thank you for watching.